Bluewater Health is one of the only hospitals in southwestern Ontario that does not have access to a helipad for critical care transportation. Having the helipad constructed for Bluewater Health is extremely important for our community to provide critical care access to patients who are needing that higher level of care and access to a trauma center, a burn center, or a children's hospital.
One of the examples where it could be particularly helpful is in patients who are in really bad traumas. Some of these patients actually get assisted on scene by the ambulance, and sometimes they actually call Orange to present directly to the scene, but Orange can't get there in a period of time and they need transfer to us. Well, what that usually means is we stabilize and try and get them out to a definitive care as soon as possible, which in general would be the London Trauma Service. In that case, if somebody has a severe head injury or head bleed and they can get to London, they can get surgery, that can mean that that person has a much better outcome. They're able to walk out of hospital versus having a significant neurologic injury where they might be impacted for the rest of their life.
As a nurse in the emergency department, it means that our patients get faster access to critical care. In a potential life or death situation, every minute counts.
At times we have patients who are critically ill requiring fairly advanced care, and while we have a lot of resources locally to stabilize them, occasionally they have to be shipped out. What comes to mind, for example, is fairly complicated advanced multi-trauma patients. A helipad would provide us with the option of more expedited transportation. Currently what happens if we have to send someone by land, we have to send our own team with them from the hospital staff, in addition to taking out EMS service out of the county as well for transportation.
From the time that an ambulance crew is committed to a call to the time that they return to the community can be in excess of 3 hours. In the winter months, that time frame can certainly be extended into 4 and sometimes even 5 hours. A helipad at Bluewater Health for Sarnia-Lambton residents means faster access to critical care and specialty services in London and even places like Toronto.
As a mom and a future mom to another baby, it is comforting and reassuring to know that we have access to timely care with this new helipad. It allows us to gain access to care quicker for better outcomes for babies and children, even moms.
Working in the nursery, I see some pretty sick babies and babies that have gone for heart surgery that we've needed to send to sick kids. So being able to fly them to sick kids faster would mean everything.
I was a critical care flight paramedic with Orange, providing care to ill and injured patients across the region. Transport medicine is really a specialty unto itself. From a patient perspective, you're dealing with a lot of specialized trauma services, access to neurosurgery, pediatrics, specialized neonatology, access to burn centers, and really specialized care that's not available locally.
The County of Lambton has generously donated $400,000 to the construction of a helipad for Lambton County. We are truly grateful to them and all of the other donations that have come through for this project. But we still need your help. Together we can build a helipad for Sarnia-Lambton that will save lives. Please consider making a gift today.